Welcome to Field Notes, Insights from N2PH Health Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2PH Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Dawn Jacobson, Public Health Strategist with the Jackson County Health Department in Wisconsin. Dawn graduated from N2PH Health in April 2023 and has since served as a mentor in the program. Dawn, can you tell us a bit more about Jackson County and the health needs in your community?
Sure, and thank you, Juliana, for having me here today. As a little background, Jackson County is a small rural county with just over 20,000 total residents. Jackson County experiences an above average percentage of residents living in poverty, and due to its rural location, residents often find it difficult to access resources that may be more prevalent in a more populated area. However, despite these challenges, Jackson County has been able to leverage great community partnerships to make some pretty big things happen. I think it's safe to say that all of our communities needed to relook at our health priorities following the pandemic, so the timing of our community health needs assessment in 2022 was perfect for re-engaging our partners. Following our needs assessment, we identified 4 major priorities, one of which I'd like to talk about today. We identified family and community support and resources as a priority, which was twofold. First of all, we recognize that we have many resources and programs in our community, but they weren't well known and they weren't being well utilized. And then second, we recognized that we also needed to identify our gap areas and explore options for bringing new resources to our community.
Who were some of the key community partners that you engaged in this work?
We are fortunate to have a networking group established in our community called the Servant-Led Community, and this group has served as an excellent platform for bringing many different organizations to the table as a space to present ideas and brainstorm on collective efforts. A number of collaborative projects have stemmed from this group, including a child care task force, a homelessness committee, and a community health worker advancement group. Key partners have included our school districts, medical organizations, social service organizations, and a number of other community partners.
That is great that you had an established group that all of these other things stemmed from. Can you tell us about an example of the work that has stemmed from these partnerships?
Sure. One great example is how quickly we've grown the number of community health workers in our county. Initially, a group of individuals from the servant-led community applied for and received a large grant to support this effort. Key partnerships included our local critical access hospital, a local school district, Children's Wisconsin, and even a local credit union. The efforts of this collaborative team landed funding to support 2 community health workers, one employed by the school district and one employed by Children's Wisconsin. The focus of these positions was to help families navigate an often confusing system to connect them with existing resources and programs to address their underlying health needs. As part of this, we partnered with the United Way to support our community health worker team through education and technical assistance, which soon led to funding to add a 3rd community health worker to our community. Growing on this momentum and wrapping in another of our priorities around homelessness, we were able to connect with a nearby nonprofit, Family Promise, who employed community health workers in a surrounding county. We quickly engaged in conversations, which led to Family Promise expanding to provide services in Jackson County, which added a 4th community health worker to our area. And then, not ready to stop there, our public health team then partnered with the Medical College of Wisconsin and successfully received a grant to fund a 5th community health worker, this one employed at Public Health. The focus of the current CHW at Public Health is to work with individuals experiencing human health hazard living situations. So all in all, our community health worker workforce grew from 0 to 5 within a 2-year span, employed by 4 different organizations. This was incredible for our small county with limited funding available to support these efforts. It was definitely a reflection of community partners coming together to meet a need, and each organization willing to find innovative ways to fund and support our priority of improving access to resources for individuals living in our county.
That is so amazing. What a fantastic partnership with all these different organizations to really leverage the capacity and support for the community. As we wrap up, what advice would you have to other public health staff wanting to improve engagement with their community partners?
Encourage public health staff to put themselves at the table in various networking groups that may be outside of their regular circle. Many businesses are community minded and are looking for an area to connect if they learn of a need they can help fill. In addition, be willing to take on the role of leading your local community coalitions. Being on leadership teams or board of directors for various nonprofits can help you to drive the conversation and get your message across. As public health continues to move away from a traditional health model to a broader focus on social determinants of health, there are a lot of new partnerships to be made. We need to continue to grow our network to better serve our residents.
That is great advice, Dawn. It's so important for public health to be at the table and to serve on boards. The public health perspective is vital, and as you said, can help drive conversation and grow our networks to better serve residents. Thank you so much for sharing your experience with us today.
Thank you.
Thank you for listening to Field Notes, Insights from N2 Health Alumni. For more information, visit new2publichealth.wisc.edu.